addition, and this is a really smart thing, the new plan requires there's supposed to be coordinated enrollment between Medicaid, the Children's Health Insurance Program, and the tax credits using simplified forms. But people have called this as a no wrong door approach. That is, if people aren't sure exactly what kind of health insurance they're eligible for, they'll be able to come in and people will try to help them get the information so they can be sorted into the correct program for them. The federal government will pay almost all the costs for the expansion of Medicaid, particularly in the first 3 years. Eventually the states will have to pick up a larger and larger share. The Children's Health Insurance Program, some people worry, is set to expire right now in 2013, will be reauthorized until 2019. Again, overall, what the Congressional Budget Office said was through the Medicaid expansions, through the tax credits and the health insurance exchanges, through the mandates on individuals and employers, that essentially speaking, they expect that there'll be 32 million fewer people who are uninsured by 2019, by a decade from now. However, it's not as though we will have totally eliminated uninsurance. About 23 million people are expected to continue to be uninsured. So it's still going to be a problem that faces us. We still need to have a healthcare system that can help people who are uninsured. Next slide. So to give you a sense of what this means, and I realize this is not the best slide, what I have here is sort of children. Right now in most states, in a typical state, children are covered under Medicaid or CHIP to about 200% of poverty. In 2014, we'll have federal coverage that will, essentially speaking, double. The federal government will be helping children up to the range of 400% of poverty. Right now, for parents in a typical state, Medicaid coverage goes up about this far. It's about 64% of poverty. By 2014, it will go up to 133% of poverty. And again, there will be tax credits that will be available to families going all the way up to 400% of poverty. For other adults, that is, adults who don't have dependent children, this could be a young person who, say, is in their early 20s who doesn't have children, or it could be someone in their 40s and 50s whose children are already grown up. Right now, in most states, there's no federal help at all. By 2014, again, other adults with incomes up to 133% of poverty will be eligible for Medicaid. Beyond that, up to 400% of poverty, they can get help with the tax credits. So it's a big expansion of coverage that will really help both low and middle income families. Next slide. There are going to be a lot of steps to strengthen the healthcare system. There's going to be more funding for community health centers. These are nonprofit centers, particularly in places that often don't have enough local physicians, whether it's in inner cities or rural areas. There's going to be more support to help primary care doctors. That's pediatricians, family practitioners, general internists, the people you see for regular care. They'll be getting increased payment rates in Medicaid and Medicare. They're going to pilot test new systems of care, both in Medicare and Medicaid, to try to figure out, can we come up with better, more innovative ways to arrange care so that people can get better quality care or more efficient care. There's going to be a system to study more effective methods of medical care. Sometimes people talk about this as comparative effectiveness research, understanding is this, what's the effect of this form of surgery versus that form of surgery on back pain, on cancer, whatever. They'll develop a national strategy to try to help improve healthcare quality and reduce healthcare disparities. One of the big deals we all know about is there's substantial racial and ethnic and gender-based disparities in health coverage and health status and access to care in the U.S. There are going to be efforts to try to reduce that. There's going to be better monitoring along the same lines of racial ethnic disparities. Right now, in many cases, our health system is not prepared to measure simple things like what's the race and ethnicity of people who get health care. There'll be better efforts to measure this so we'll know where the differences exist. Next slide. Medicare. This is the health insurance program for senior citizens. Beginning in 2010, senior citizens who have Medicare drug coverage will get a $250 rebate if they enter the area that's known as the donut hole. And you heard a little bit of discussion about the donut hole earlier. Let me explain a little bit more what the donut hole is. For people who are getting Medicare drug plans, the goal in the legislation a few years ago was have something to help people immediately when they get, when they have some prescription drug expenses or when they have catastrophically high drug expenses. There was a middle area where there was no assistance offered. That's what they call the donut hole. So there's something on the inside, something on the outside, nothing in the middle. What this means is that right now, if you have, roughly speaking, $2,800 in drug cost, at that point your Medicare coverage kicks out. If you have around $4,600 in out-of-pocket drug cost, at that point your Medicare coverage begins again. The goal will be to fill in this range so that throughout that whole area, that people will always have some insurance coverage that will help them. There'll be efforts to reduce overpayments that are going to what's called Medicare Advantage plans. These are managed care plans that help many Medicare beneficiaries. There are going to be a lot of ways to monitor and reduce the cost of Medicare. One of the net results about this is people talk about there's a Medicare trust fund that could run out of money before too long. The whole plan will extend the solvency of the Medicare trust fund for about a dozen years. Next slide. So some final provisions. There's going to be more funding for public health provisions. So more things to help people in the community lose weight, stop smoking, take care of themselves, do things relating to immunizations, etc. There's going to be nutrition labeling for chain restaurants and vending machines so that people will understand, what's the calorie count, what's the nutritional content of the foods they're getting. There's going to be a new voluntary program to help pay for non-medical home care services for senior citizens and people with disabilities. It's going to be called the Community Living Assistance Services and Supports Program, or CLASS. Next slide. And this I'm wrapping up, which is sort of where's the money coming from? Because this is going to cost a lot of money. In total, this will cost over the next decade, according to the Congressional Budget Office, cost the federal government a little under $1 trillion. So it's a lot of money. Much of the money comes from Medicare and Medicaid savings. That's a lot of it. There will be some taxes that will be added. There'll be an excise tax on what's called high-priced health insurance premiums. That's not going to start until 2018, but the hope is that after that time, that will help force people to sort of bring down the cost of some of the very high health insurance premiums. There'll be a higher tax for wages on Medicare for individuals who have incomes over $200,000, or for couples who make more than $250,000. So it's for those who are higher income people will have a higher Medicare tax. In addition, the Medicare taxes right now apply only to wages. For higher income people, the Medicare taxes will also apply to investment income and to unearned income, so it'll try to sort of broaden that base of where the money's coming from. And so these things packaged together with some other changes basically will help cover the cost, according to the Congressional Budget Office, will generate, roughly speaking, $1 trillion in savings or new revenue, so that actually CBO would say that the total cost of the federal government should actually pay for itself over the next decade. I think this is my last slide. Is that right? Yes.